I have Steve Talajkowski with me today. I met Steve at a continuing education course. We were doing empowered relief together, and he was kind enough to give me a lift to the airport afterwards. And I think I talked his ear off, but we had a really good chat, and I got to find out about what he does and who he helps. And that's what I want to share with you today. So without further ado, I would like to introduce Steve and say, hi, Steve, tell me a little bit about your story and what led to you becoming a physical therapist.
Oh, well, hey, well, thanks for having me on. Yeah, when I took this class, I didn't expect to meet you and to open up another door of being able to share, some of my knowledge. I'm a physical therapist. It's been over 30 years now, and I work in the Bay Area. And I was lucky enough on my about 26 years ago to take a job with and work with a man called Peter Edgelow. And Peter developed a program for treating thoracic outlet. So since that time, I started working in Hayward, which is where I'm at now. I've been seeing thoracic outlet patients, and then Peter retired, and then he passed away, several years ago. So I've kind of taken over the responsibility of seeing these patients. So I really enjoy it. It's a challenge, but it's a problem that people need help with, and they don't always find the right person that understands it. And I think hopefully I'm one of those people. So
Yeah, that's great. So let's start with, can you please share what thoracic outlet syndrome is and how it differs from other sort of related conditions?
well, it's both simple and not so simple, but I would just say the thoracic outlet from an anatomy point is the area from there's muscles that come from your neck to your first rib, and they're called the scalenes. So it starts from the scalene muscle, and it ends at the pec minor. So it's just an anatomical space where the nerves that go into your arm travel through. There's also an artery and a vein that goes through that same space, although technically the vein starts a little bit later. So what happens though is there's a compression of that nerve bundle primarily. There can be a vascular compression, but the nerves get compressed, and then the patient has symptoms either going into the shoulder, up the side of their face, or down their arm. And because it's a bundle of nerves, the symptoms can be a little different from patient to patient. Although a very common presentation is the symptoms go down the elbow side, the inside of the elbow, down to the ring and pinky finger. So it's really just it's a nerve compression problem, which is similar to having, let's say, carpal tunnel, cubital tunnel, even a sciatic pain, which are all nerve compressions. So it just happens to be like where it is and what nerves are compressed, and at what place they're being compressed. I'm not sure if that was.
Yeah, no, that's great. So I know you already mentioned the Edgelow method and that being a key to you learning how to successfully treat and help people struggling with thoracic outlet syndrome. So can you share some of your most important elements of your journey with Peter Edgelow and important things that you learned from him?
Well, Peter developed this program. It is a protocol, so it has a series of steps. Part of it's exercises, and part of it's just sort of the approach that you would, understanding the problem. So, I mean, Peter was big on understanding what the consequences were of this nerve compression issue, and so a lot of it was patient education, probably having an expectation of how long things were going to take and sort of what steps needed to be taken along the way. A big part of his philosophy, which is mine anyway, is to not to increase pain, not to aggravate the patient. It's not a no pain, no gain kind of an approach. A lot of it's involved around self-assessment. So you take measurements and assess your progress or lack of progress. And those assessments also help you determine when you should progress to the next level. So, it's not just an exercise program, it's kind of a philosophy on how to kind of deal with a chronic pain problem.
Yeah, I love that. I share a lot of those philosophies for sure. So
Yeah.
what are some of the most common mistakes people make regarding thoracic outlet syndrome?
Probably looking, the people are usually probably too aggressive at first. And I think people are identifying weaknesses and tightness, either nerve mobility issues or shoulder or cervical limitations, and so they're treating the the weakness and the stiffness as the cause of the problem, and I'm looking at it more as it's the result of the problem. So if you have a nerve compression issue and you have weakness or tightness, rather than treat the weakness and the tightness, you have to treat the nerve compression. So probably the first step is relax muscles, open up spaces, calm things down first. So there are stretches and strengthening approaches, but they're later in the program. But for a lot of patients, they come in, that's the first thing they get. And so that's probably the biggest problem. And then what happens is people get worse, and our approach to life is, if it hurts, just keep pushing through it. And then people just kind of keep pushing through it. And then they just make themselves worse, and then they kind of blame themselves, or people blame them for not trying hard enough. And so it becomes kind of a cycle of things calm down, you feel better, you keep going, you make it worse again, and then people just kind of spiral or go in a vicious circle.
Yeah. I mean, just listening to you talk about that then, I mean, you could be describing tennis elbow, because this is the story I hear all the time. And certainly my method is split into different phases. Strengthening is in phase 3. And you're absolutely right. People just want to know, what are the strengthening exercises I need to do? And I have to explain, no, you've got to go through phase 1 first, and then phase 2. This is going to calm things down. It's going to prepare the tissue so that you can tolerate the things that you need to get to later on.
Exactly.
So yeah, I love that you mentioned that. It definitely fits. Yeah, for sure. So what is one of the most important elements then of the self-help strategies that you would give to somebody suffering with thoracic outlet syndrome?
Well, I mean, one of the first exercises, and I hate to kind of sound like, one of the first exercises that we do in the program is a breathing exercise. And it almost sounds too simple. So I think that some people will kind of roll their eyes a little bit, because, well, what's breathing going to do? But but within that breathing exercise is a postural change. Within that breathing exercise is learning how to control muscle activity. So do you breathe from your chest, or do you breathe from your diaphragm? If you're breathing from your chest, and if you remember what I said, is one of the first muscles that the brachial plexus travels through are scalene muscles. Well, the scalene muscles are both postural and breathing muscles. So in the treatment of thoracic outlet, breathing and posture is extremely important, because that's the way that we can start to kind of open up that space. But opening up that space initially doesn't necessarily mean things are initially better, because if you have a nerve irritability problem, it takes time for that nerve to calm down. So you're you're combining both this sort of breathing postural exercise at the beginning with this expectation of it taking time. And with also the expectation of there are probably things that are going to happen during the day that are going to still aggravate it. And so the progress at the beginning is kind of slow. So I think we're used to sort of quicker solutions. And in the case of something like thoracic outlet, or for a lot of chronic conditions, the solution's not really simple or quick. Well, maybe it is simple. It's just not quick. And then I think trying to get a person to buy into that belief that it's just going to take time. We're going to have to look at things in a big picture. We're going to have to change sort of things that don't seem to necessarily directly affect the problem, but in reality, they do directly affect the problem. So yeah. I'm not sure. I might have got lost on that answer, but
no, you absolutely talk my language. I totally agree with everything that you are saying. And you're right. It's so related to so many chronic conditions that people are suffering with. So I'm really going to put you on the spot here, Steve.
Sure.
Can you take us through that breathing exercise right now?
Well, there's two ways. Well, there's more than two ways to do it, because so if I were to start out, the person would be lying down, and the reason I think I'm like lying, that I tell the person to lie down first, is that I'm trying to take away all the postural challenges at the beginning, where all I want a person to do is focus on being able to breathe from the diaphragm, or to be able to identify if they're not breathing from the diaphragm. So, and for some people, that's a challenge, because no one's ever mentioned, people haven't talked about breathing from the diaphragm, or even how to do that. So for some patients, it's a challenge just to breathe from the diaphragm. And then what I'm also doing is, I mentioned a little bit earlier, is that, I'll take some measurements. So I'll take their hand temperature. I'll check a lot of patients will have, as they raise their arm, and as that brachial plexus starts to travel underneath the clavicle and the pec minor, they start to feel sort of a tension sign in their elbow. So very simply is, I'll take a couple of measurements. Those measurements might be relevant. They do their breathing exercise, focusing on their diaphragm. And then after they're done, we'll retake those measurements again, and to see if there is an objective improvement. So the very first day, I'm trying to teach the diaphragmatic breathing, but I'm also trying to show that breathing had an effect on their body. Because if you just talk about breathing, it doesn't seem that important. When you look at their objective measurements, the things that I think are related to this nerve entrapment, and then you can show that within literally 5-10 minutes of doing this exercise, they can see a change. And now it doesn't mean the nerve is calmed down, but it just means that they were, for that 5 or 10 minutes, able to sort of open that space for 5 or 10 minutes. And that's really the beginning of making that change in a more lasting, more kind of effect, a long-term effect. And then even the first day, you tell people, okay, we're going to start without giving people too much information, because you can't give everything the same day. How are you breathing when you're sitting? And what position are you in? Are you in a position where you're your slouch, your shoulders are forward, your head's forward. All those things are causing compression. And even though at the beginning, the first visit, I'm not able to necessarily change all those things, we're starting to create an awareness of what we can work on. So I'm not sure if that was clear.
Yeah, no, absolutely. And so do you use sort of mind body techniques as well? Do you use things like visualization, progressive relaxation, meditation, those types of strategies?
I think the things that we're doing with that first exercise brings in parts of that. I probably don't call it that, but I think what, I mean, I'm always trying to give the idea that breathing is also connected to being in the moment and awareness, and try to, and people can kind of connect with that idea of like, yeah, I'm you know, when I'm at work, I'm just thinking about work. There's a lot of stress, there's a lot of tension, there's, you know, I'm not thinking about myself. And so we're trying to introduce moments of being aware of like where you are at the time, and muscle tension, and taking care of yourself. I mean, people understand meditation, I think, more. So I do kind of relate that some of these steps are meditation like, maybe a lot like meditation, because with meditation, it's focusing on breathing and being in the moment, and trying to, you know, again, build up that awareness. I think the problem comes in is that for some people that resonates, and other people it's like they look at it as a, hey, I got this nerve irritation problem, like what muscle is it, what rib is it, what nerve is it? And so it becomes like the visualization, meditation part, the breathing part sometimes seems too big picture, too holistic. Although I think we're hearing more and more about, you know, that part of our life being more important. So, you know, I'm not sure.
Yeah, no, I think you're right. I think we're definitely heading in that direction for sure. So if you had to tell people one thing about thoracic outlet syndrome, what would be the most important thing that people would need to know?
Well, don't start with stretching and strengthening. Don't aggravate it. It takes time to get better. Sometimes a person gets better just as much from what they don't do than what they do. Things will flare up, so don't be too hard on yourself. But expect to get better. I truly believe that if we do the right thing, people can get better. I don't care what the condition is. So I think thoracic outlet's been kind of painted with some patients as being kind of a hopeless thing, and like there's not really an answer. I would say, I mean, there are some anatomical problems, so it's not strictly just being able to sit and breathe and open up space and calm things down. I mean, I do see patients that have surgery. They have an anatomical problem. The space is too small. The muscles are wrapped around nerves. There's a rib problem, pec minor problem. So there are cases where these things don't help. What I like to think, though, is that if a person went through the program, and I have a couple physicians that send me patients, if the person goes through the program, really kind of sticks with it and doesn't get better, then there is another answer. There is another step to be taken potentially. And so I think people feel better that if they did have surgery, it's because they needed it, and that they tried the conservative approach and it didn't work. So So I don't want to, and even surgery sometimes leads people with, they still have some residual pain. So it gets a little more complicated when you start getting into these anatomical problems, because it's not just breathing and posture and opening up spaces, but majority of patients it is. So all you're trying to do is you want to find the right patient for the right treatment. And if it's a surgical answer, then you got to find the right doctor. If it's a non-surgical answer, I think there's a conservative way to approach it. And that's where I try to help.
Yeah, I think that makes absolute sense as well. So how can people find out more about thoracic outlet syndrome? How can they link to you? How can they learn from you? What's the best options there?
Well, I'm with the group, tosmri.com. It's a group of people, doctors. I'm on the group that they're all over the country. They help guide people through the process. They have different doctors across the country. So if a person were to call or contact the website and say, hey, I'm in Florida or New York, do you know anybody in that area? They could possibly connect you with a professional in that area. There are some videos, YouTube videos that the group has produced, and they're on the website. I'm on a few of them. There are some doctors and surgeons and neurologists on there, just people just trying to give information. So I think the biggest step is just to find somebody who understands the problem and who believes in that there's a treatment for it. And a lot of patients that get a hold of the group have found that it's been hard to find somebody that understands it. And so it's a relief to finally find somebody. Now, finding somebody doesn't, that's just the first step, but at least it's a step in the right direction, right? So you have to find a person that knows what they're doing. I'm not saying the process is easy. It can take several months. It can take a year for people to really fully, recover the best that they can. So it's not a quick fix, but if you at least can get in the right direction, then you have a chance of getting there.
Yeah, no, I think that's great information. Thanks for that, Steve. And again, it totally echoes exactly what I tell my tennis elbow clients. It's find the specialist who knows about this condition, and it's going to take time. But you definitely talk my language. I cannot thank you enough for speaking with me today and sharing your knowledge. It was such a joy to be able to connect with you at the conference that we were at. And I'm so glad that you were able to give me a lift to the airport.
It was my pleasure. And I said, it was just, it was a great fortune I got a chance to meet you, because, you're just seeing the things that you do are inspiring me to reach out to more patients. And so if this is even a small step in that direction, then I'm thankful that you gave me the chance to do that.
Absolutely. I love it. Thanks so much, Steve. And I hope to have all of our listeners back on the next episode. If you want to reach out to Steve, I'll put all of his information in the show notes. And if you have any questions, queries, comments, don't hesitate to reach out to him. He's an absolute fountain of knowledge on this particular subject. So add him to your super list of contacts as somebody to be able to tap into if you have this problem, if you suspect you have this problem, or if you know somebody. Pass on the information. Knowledge is everything. Thanks so much, Steve. I really appreciate your time.
Oh, hey, thanks for having me on. Great. Thank you.